Caffeine. Caffeine is one of the most commonly used stimulants in the world. It is found in coffee, tea, energy drinks, and some medicines. Caffeine works mainly by blocking adenosine receptors in the brain. Adenosine is a chemical that makes us feel tired. By blocking its effects, caffeine can make us feel more awake, alert, and less tired for a period of time. It can also increase alertness and, in some people, temporarily increase heart rate. However, consuming too much caffeine can cause problems such as restlessness, shakiness, anxiety, a fast heartbeat, and difficulty sleeping. The effects can vary from person to person, depending on how much caffeine they consume and how sensitive they are to it. Alcohol. Alcohol is different from stimulants because it acts mainly as a central nervous system depressant. This means it slows down brain activity and can affect the way a person thinks and behaves. After consuming alcohol, a person may experience reduced coordination, slower reactions, poor judgment, and difficulty making decisions. With higher levels of alcohol in the body, speech may become unclear and movements may become less controlled. Heavy alcohol consumption can also affect memory and, in severe cases, can lead to alcohol poisoning, which can be a medical emergency. So, although alcohol may initially make someone feel relaxed or less inhibited, it can significantly affect the brain and body, especially when consumed in large amounts. Nicotine. Nicotine is a highly addictive substance found in tobacco products, including cigarettes and some other nicotine-containing products. When nicotine enters the body, it produces a relatively rapid, stimulating effect. It can increase heart rate and blood pressure, and can cause blood vessels to become narrower, a process known as vasoconstriction. Nicotine also affects the brain's reward system. With repeated use, the brain can begin to depend on nicotine, making it difficult for a person to stop using it. This is why nicotine has a high potential for dependence and addiction. Even when someone wants to quit, withdrawal symptoms and cravings can make the process challenging. Cannabis. Cannabis affects several areas of the brain involved in mood, memory, coordination, and sensory perception. Its effects can vary from person to person. Some people may experience relaxation or changes in their perception of time, sounds, or their surroundings. However, cannabis can also affect short-term memory, concentration, coordination, and reaction time. This can make activities that require quick reactions, such as driving, particularly dangerous. Some people may also experience unpleasant psychological effects, including anxiety, fear, confusion, or paranoia, especially after using a large amount or when they are particularly sensitive to its effects. Cocaine. Cocaine is a powerful stimulant that has a strong effect on the brain and nervous system. It can produce a rapid feeling of increased energy and alertness, while also increasing physical arousal. However, these effects come with serious risks. Cocaine can raise heart rate, blood pressure, and body temperature. It places significant stress on the cardiovascular system and can increase the risk of serious problems such as abnormal heart rhythms, heart attack, stroke, and overdose. The effects can be unpredictable and the risks can be especially serious because cocaine strongly affects both the brain and the cardiovascular system. Different substances affect the body in different ways, but none of these effects should be taken lightly. Some can lead to dependence or addiction, while others can cause serious or even life-threatening health problems. Understanding how these substances affect the brain and body is an important step toward making informed and safer decisions.